All right. Hey guys, Dr. Nixon here. Hope you all are doing well. Have a wonderful day. Hey, listen, so excited for today's training. We're going to talk about ear infections, especially in kiddos. That right there, that picture that was just up, that's a picture of my wife and I and our little guy. His name's Lincoln. He just turned 3 not too long ago, a couple days. August 1st was his birthday. So I have a 3-year-old at home, and I love that guy so much, and I love being a dad, and it's so much fun. But he actually had his very first ear infection not too long ago. And man, I've taken care of so many kiddos over the years in our practice who have had ear infections, and some with chronic ear infections, some with tube issues, and been able to help them. And it's been wonderful. But to actually see your own son going through an ear infection, it was so sad. He was at the splash pad and got some water in his ear, and he ran over to grandma, and he's like, "Grandma, do you hear that?" And she's like, "Hear what?" And he's like, "This whooshing sound." And then all of a sudden he just starts bawling, just crying in pain, and my ear hurts. And so I'm gonna walk you guys through what I did with him and what we would do with any of the kiddos that come in our practice, how to help them get over an ear infection fast. And so I followed this protocol, did exactly what we teach our patients, and honestly, within 6 hours, Lincoln was pain-free. His ear infection was gone. He no longer had any issues. He was running around with his cousins. We went out to dinner that night. It was awesome. And so if you know anybody whose kiddos struggle with ear infections, or a family member who has young kids who deal with, especially during the summertime when we're in the water, the pools, the splash pads so much, share this video with them, hit the like button, hit the share button. We want to help as many people in the community as we can. That's what this is all about. So let's jump into it. I'll show you guys this, natural remedies for ear infections. First, let's talk anatomy. Here's a great picture, the anatomical model of the ear. What we know is a lot of the inner ear infections, otitis media issues, is how we're just gonna go back here, refer to them. A lot of times the anatomy of it and how it actually starts is the tubes in kiddos up until about the age of, they say 4 to 5, their tubes are very horizontal. After the age of 5, they begin to, so in adults, they dip down a little bit more. So what happens is you have this horizontal plane in the ear, and so water from the swimming pool, splash pads, bathtubs, whatever, can get lodged or stuck in there. And so what happens is it's warm, it's moist, which is a great breeding ground for bacteria. And so when bacteria start, an inflammatory response happens on the eardrum. This is where it becomes swollen or red or painful. When the doctor looks in there, they're like, "Wow, it's so swollen in there, the kid's in pain." And that's really the way an ear infection happens. There's a lot of good research that would actually communicate out of the pediatric world that most ear infections begin as a viral issue. And viruses run their course. So you'll find more and more pediatricians who, instead of just prescribing antibiotics, they'll actually do the kind of wait and see approach, meaning, hey, like a lot of ear infections will clear up on their own if you just take care of your kiddo, give them good nutrients. So more and more we're seeing pediatricians holding back on the antibiotics, or just not, prescribing them right away, because we know too much antibiotics creates super bugs and creates other issues, and so trying to avoid that as well. There is a time and place, obviously, for antibiotics, but more pediatricians are doing the wait and see approach. So during that, kind of wait and see, what do we do? So here's what I did with Lincoln. Obviously, as a chiropractor, holistic chiropractor, I know the value of the nervous system and how much, obviously, it controls everything and how effective it can be. So one of the first things he did when he got home was I checked his upper cervical spine. So that's the nerves in the very top of your neck, so the very base of your skull. Those nerves control eyes, ears, nose, throat. And what we know is that there's a misalignment there. It can actually create a structural misalignment that gives the body a propensity towards an ear infection. So I adjusted that. I also adjusted his ear. You have 3 bones in your ear. This right here is a really good clinical chiropractic research study done. It was over 300 kids ranging from days old to about 5 years old with chiropractic adjustments. They did 4 to 6 adjustments on each of the kiddos and found a positive correlation between the adjustments and reducing ear infection issues. And so I adjusted, like I said, both his upper cervical spine and his ear. That picture right there, that's our office. That's where we adjust kiddos. When my wife created our brand new clinic here in Winston-Salem, we created this room. It's a soundproof room where we take care of kiddos, and she created a safe and separate space for families and kiddos to get adjusted together. And so adjusted the upper cervical spine. That's our office there. Adjusted his ear. And then I started following these protocols. The next thing I gave him was garlic oil. Garlic in general is antiviral, antibacterial, antifungal. So garlic oil, it's really simple. It's just extra virgin olive oil with garlic in it. There's a recipe. If you go to Wellness Mama, look that up, wellnessmama.com, search garlic oil recipe. That's the one I made. Her resources are great. It's very inexpensive and very helpful. So I put a couple drops in the ear where he was feeling the pain. So the next thing I did was we did the same exact thing with colloidal silver. One of the things I ran into, he was in so much pain. He was so sad. And so it was really hard to get that in his ear. So at one point he actually fell asleep. I went down for a nap, and it was very easy to get both of those in. So depending on your kiddo, if your kiddo's asleep and you put that in his ear and he wakes up, I'm sorry, but you know your kiddo better than I do. But we put that in his ear. Colloidal silver on contact can actually kill bacteria. It's very, really helpful for that. We use this stuff for pink eye. We'll use it for sinus issues. It's a good thing to have on hand, colloidal silver, but really, really helpful for ear infection. So again, just a couple drops in the canal. The one that's hurting is how we did that. In fact, colloidal silver, for all my Lululemon fans out there, if you wear Lululemon, chances are you're wearing one of their products that has silver thread in them, and they call it anti-stink. And the reason why it's anti-stink is the silver kills bacteria. So as you're sweating and bacteria is there, it kills off the bacteria, so it produces less odor. You're welcome. So there you go. Lululemon, not sponsored, but colloidal silver is very helpful. Very, very helpful. So the next thing I gave him was vitamin D. So the first two I said, garlic and silver, kill bad bacteria, kill viruses. So you're killing off the bad stuff, the junk that's in there. Next, you want to boost the immune system. So you want to help his body and his immune system fight it off. Vitamin D will do that. Vitamin D naturally comes from the sun. A lot of times, depending on the season, especially like cold and flu season, we're not getting as much vitamin D. But vitamin D is really good for the immune system. So I gave him some of that. I used the liquid one for Lincoln. Again, he's 3, so he's not swallowing pills, but he will do the liquid. It's made of a vegetable glycerin. We use a company called Vitamin D to the Rescue. It's made by another company called Designs for Health. You can find that stuff on my website as well. So really good product. My website is twincityhealth.com right there. So gave him some of that, boost his immune system. Vitamin D really, let me go back here. And then this is the last thing I gave him. So you're killing off bad bacteria. You want to help his body do that. And one of the ways to do it is by adding in a probiotic. So probiotics are good or healthy bacteria. So that probiotic, that's the one I use on him. We give that to him probably on a weekly basis. We'll maybe give it to him 3 or 4 nights out of the week. When he's sick or fighting something like an ear infection, we'll give him more, but probiotics are healthy gut bacteria. They help the digestive system as well as your immune system. Remember, the majority of your immune system, a lot of your immune system comes from your gut. So the gut bacteria, healthy gut bacteria like probiotics is really helpful for the immune system. And as a kiddo, as a baby, most of the immune system in a baby comes from the mom. So if you have a kiddo who maybe has a weak maybe gets sick often or chronic ear infections, probiotics might be something worth giving them on a consistent basis. But I hope this was helpful. So you start by adjusting the ear, adjusting the upper cervical spine, drain stuff out, put stuff in that's going to kill bacteria and kill viruses. That's your garlic and your silver, and then rebuild the immune system, vitamin D and probiotics. In that little concoction right there, Lincoln had a fever. He spiked it. He took a nap. He killed that stuff. We put that stuff in his body. Within 6 hours, he was up, running around, hanging out with his cousin. So it works. I know having a kiddo with an ear infection is so sad, but just take care of them, love them, lots of snuggles, lots of prayer. They'll get better. The body's good. It wants to heal. It's created to fight off infections, bacterial or viral, and it can. You just got to take care of the immune system. So I hope this was helpful. If you have any questions, if you're a mom out there, maybe has kiddos who have chronic ear infections or have had tube surgery, and you're looking for a little bit more help or maybe a holistic approach at it, go to that link right there. It's my Calendly link, and my calendar's on there. I do free 15-minute virtual consults. If you have any questions, I'd love to help you guys. So just find a time on the calendar and we'll make that happen. Love you guys so much. Bless you. I'll see you next time. Again, this is Dr. Nixon with Twin City Health.